Lower blood pressure. How do you think they do it? Basal, who said that? Didn't sound like his voice. Basal dilation, exactly.
They are selling it now.
Exactly.
Yeah, it must have been like a month ago.
We have regulated blood pressure. I'm not going to have you discuss all this. When you get into adult health too, you'll be going into this ad nauseum. But this is just to show you the process that happens that creates your hypertension. So all these different steps. That's all I'm going to say. We have baroreceptors in the aorta, the carotid sinus, and so forth. These receptors are responsible for maintaining the continuity, if you will, of the blood vessels. Your vasomotor center is in the medulla, and then hormones you have naturally are what you see up there. Risk factors for high blood pressure: a lot of saturated fat, carbohydrates, alcohol, all the fun stuff in life you can't do.
Of course.
My wife always gets mad at me because she has high cholesterol, and I don't. And it's genetic, by the way. It really is. You can eat a whole bunch of junk and you can still be okay for a while. You can't do that with you. Fasting, she'll have a blood cholesterol of 234. And after I've had a 4-course breakfast, I'll get my blood tested and it might reach 170. But these are risk factors. Eventually they do catch up with you. Categories of blood pressure. Again, this is for your own information. This changes constantly, by the way. It used to be that normal blood pressure was all the way up to 140/90 was considered normal, and then anything after that was considered high, and it just keeps coming down every so often. It gets lower and lower. Years ago, high blood pressure was 165/95, and then it was 160/95, and then it was 160/90. And 150/90. Now it's 140/90. Considered pre or early hypertension. And these guidelines are used in medication or just change in lifestyle. Some people are predisposed to hypertension. It can be caused by race, gender.
Being a nurse?
Will cause, I won't get into that. I don't want to get you. Okay. Antihypertensive, we come to our diuretics again. So how would diuretics cause a decrease in blood pressure? Okay, we're decreasing the fluid within the vascular system. Therefore, we're decreasing the pressure the heart has to exert against that pressure in order to work appropriately. And we have our the diuretics we've already talked about. We have our beta blockers, alpha agonists, adrenergic blockers, adrenergic neuron blockers, and alpha and beta. All these are doing is that they are going to specific receptor sites. They have beta receptor sites. They have alpha receptor sites within the blood vessels. And all they're doing is they are interacting with those and causing vasodilation. Okay, that's the bottom line of what they're trying to do through these different actions. We have what's called non-selective beta blockers. Okay, here are your LOLs again. Because these are not only affecting the blood vessel, what else are they affecting? They're affecting the heart, they're affecting the contractility in that of the heart as well, aren't they? Okay, letting it beat more effectively and so forth. And then cardioselective and contraindications. Contraindications, clients with diabetes mellitus when taking beta blockers. Who read that part? It increases diabetes, or it decreases the effectiveness of certain anti-diabetic medications. Side effects: marked decrease in blood pressure. You can get what's called orthostatic hypotension. So as you stand up, you pass out. You can have some of the other issues as well. As you understand, these things are working through the nervous system. Therefore, we can see things like depression because of the fact that it's slowing things down, the nerve response, and then that can lead to this along with the disease process itself. It's important that the person does not stop this abruptly, or they have what's called rebound hypertension. That means it gets worse. It's like if you've been taking your nasal decongestant and you're supposed to take it for 3 days, and on the 4th day you take it again, and all of a sudden your nose gets all blocked up and doesn't open up anymore. That's rebound congestion. The actions, okay, we go to the receptors, result in vasodilation and decreased blood pressure. The drugs, as you see here, the alpha adrenergic blockers. What's the similarity? S-I-N at the end. As you see there, prazosin, hydrochloride, mini-press. Is that the medication? When you're looking at the suffixes, you look at the generic, not the brand name. That's what tells you. The brand name itself will tell you anything in the world, but the generic portion gives you that suffix, which leads you to decide what kind of medication it is. Make sense? Contraindication, impaired liver functions, side effects. I can see there direct, frequently prescribed to avoid fluid retention. The diuretics are used to limit the side effects of this medication. And therefore it works, makes it more better. We have ACE inhibitors. We talked about those in the heart, didn't we? They also cause vasodilation as well as affecting the heart rate. There are some people, African American adults, older adults, do not necessarily respond to ACE inhibitors alone. They have to have another medication along with that. And they generally don't respond well when you take with diuretics. So generally you'll have those individuals on more than one type of antihypertensive medication in order for it to work effectively. And you need to keep that in mind when you're looking at medication. When you see somebody is on 2 different antihypertensive medications and you wonder, okay, does the doctor know what he's doing? He's lowering the blood pressure further. It's because the person may not respond to one, but they respond to the combination thereof and get the same effect if they're using one. We have angiotensin receptor blockers. Again, these are medications that are, again, at the receptor sites. They block the site, so therefore you have vasodilation. And those alone, again, are less effective. Calcium channel blockers we talked about already, didn't we? They're doing the exact same thing. Remember the calcium channel blockers slowed everything down? But one of the side things it did, vasodilation. So it's doing the same thing, it's affecting the heart, but it's also affecting the blood vessel.
Bless you.
In nursing intervention, it's important that they don't ingest grapefruit juice or the juice with high acidity that tends to intensify the drug. Other antihypertensive, we have direct acting arteriolar vasodilators, as you can see here. The side effects, again, as you can see on the screen. All this means that these medications are acting directly into the blood vessel itself and not on the heart, just affecting the vessel. Okay, this one is going. You guys can look at this on your own. It's all the different steps on how blood clots are formed in order to clot things off and you hurt yourself. And there they are. There's the different steps. You can look at that on your own whenever you have other. We have heparin. We have low molecular weight. One example is Levinox. That helps with an anticoagulant. It interferes in those steps of coagulation. It steps in there and interferes with that so the blood cannot clot. Either it does it in the, in any one of those areas. The only contraindication is we have stroke, peptic ulcer, blood abnormalities. They say stroke because the majority of the strokes are caused by a bleed versus a clot. If that is the case, we give them a medication that's going to help them bleed more, but that's going to prevent or pose more of a problem. Administration of heparins is we're trying to reach a Prothrombin time or a clotting time of anywhere 1.5 to 2 times the control, which is here 60 to 70 seconds. So we're not trying to prevent clotting in itself, we're just trying to slow it down. Why would that be important? To slow clotting down.
So,
Say that again? Circulation. We just come from heart failure, right?
mm-hmm.
So now we have a slowing down of all the circulation caused by the impaired pump. So if it's slowing down, the blood slows down for long enough, then it tends to start coagulating. And now we have blood clots, which we don't want because they get thrown everywhere and cause a problem. So therefore, we want to have it slowed down enough to where the blood is not going to clot and cause an issue as it slows in circulation. We have a direct thrombin inhibitors. Okay. Thrombin is what? The clot. Thrombin is the clot. It is administered IV or subcutaneous, depending on the kind of medication we use. This prevents the clot from forming. Oral anticoagulants, we have warfarin. What's the other name for warfarin? Coumadin. Okay. Again, we're trying to go 1.25 or close to that 1.5 before 1.5 to 2. In that same range, we're trying to go in order to prevent clotting from happening right away. Drug and herbal interactions is we have to be careful because there are a number of herbs which can intensify the effect of this medication. So you're taking your whatever leaf product you have, and you're taking Coumadin, and all of a sudden you fall down and get a cut in your skin, and you can't stop the bleeding because of that dual effect. Oral anticoagulant antagonist, what is it? Say it louder. Vitamin K. No, it's not special K. Don't go run home and eat cereal. Although it has vitamin K in it. Vitamin K reverses this process. Antiplatelets. What do platelets do? Clotting. They are one of the aspects of that clotting process. So we prevent the platelets from clotting together, and we have some of our favorite ones like Plavix. And you've all seen the commercial with the blood vein opened up and the real live artist conception of blood flow, and then showing the Plavix as the platelets all clot together and it prevents blood flowing, and then the person dies. But they're saved because their doctor knows about Plavix. But it prevents that clotting for whatever reason. Herbal products, garlic and ginkgo you should avoid. They will affect this clotting process. Thrombolytics, purpose, they dissolve the clot. We do that for a stroke, a contusion. It's also used in central and peripheral IV casts, PICC lines, when they get clogged with a clot. Medications like streptokinase are used inside that IV tubing in order to loosen that clot and then allow it to be free again.
On that other one, you said to stay away from garlic and ginkgo.
Correct.
Are we talking cooking? Because my husband's on Plavix and I cook all the time with garlic.
No. We're talking taking garlic, taking the pills, taking the ginkgo pills, taking garlic pills. You can cook with it all you want.
I mean, I cook tons of garlic in the food.
He's Italian and he's gonna die.
No wonder why it's not working.
Anti-hyperlipidemics, vasodilators, peripheral vasodilators. We have lipoproteins in our body. We have HDL, which is good. We have LDL, which is bad. We got VLDL. Dr. Barr said the more HDL you have, the better. They weren't entirely correct. There's a limit to everything. It's like an apple a day keeps the doctor away. Well, if you eat a bushel a day, you're going to have a problem. We have non-pharmacological methods. Again, diet, exercise, stop smoking. When I did a research on this, it was interesting. There are two things that help this in a person. One was our friend garlic. Regular dose of garlic, not the pill or so forth, but cook with garlic. Just garlic. Don't have pasta because that's too high cholesterol. And red wine was the other one. Tannins in red wine actually helps to lower cholesterol. And then about a year later they said, oh, white wines do the same thing.
Yeah, that's what I
Next will come up, Jim Beam does the same thing. I don't know what they're going to do. Yeah, that's right, moonshine's really good for you. Again, most is caused by genetics. If you have a genetic predisposition, doing this is going to limit you from having really high cholesterol. But you can't fight genetics. I had a neighbor in Wisconsin. Her normal cholesterol was 680. Both her parents died before the age of 60 from too much cholesterol. And she walked to work every day, 3 miles there, 3 miles back, ate like a rabbit. Ate nothing but vegetables and went on a vegetarian diet and never got her cholesterol down below 600. Ever. Genetics. Genetics. I don't know. When I left, she was 38, but we had a long discussion. Her and her husband decided not to have any kids, so they wouldn't pass this on. So that it stopped. Not adoption because by family history, she'd be dead by the age of 50.
You have drugs for it.
Risk factors, your cholesterol is at or above 270 is considered a risk factor. You need to keep it below that as much as possible. You have to have some cholesterol because your hormones are made out of cholesterol. If you didn't have that, you wouldn't have hormones. Then we wouldn't have male, female. It'd be really boring. Okay. And type of anti-lipidemics that we have up here, as you see, basically all they do is they either decrease the amount of cholesterol or they inhibit the absorption of the extra cholesterol. That's all they do. And like in statins, what they do is they decrease or help the body to not produce as much cholesterol as it used to. Hopefully to keep that process down as well. So if you add that with diet, then your options are better, your risk factors tend to fall off. Statins decrease production of cholesterol in the liver. That's where your cholesterol is produced. An example is Zocor. You've seen it on TV, haven't you? Mm-hmm. It's best to administer in the evening. You have full effect. Why do you think that is?
So you don't oral, can you take anything else orally?
That
That will cause it to interact with the medication.
That is one reason, and there's one other reason.
It makes you tired.
Well, you just said that. I'm sorry. What happens in the evening and as you go to bed, everything slows down. Okay, and now we have a more readily or more effective absorption of this medication as we would otherwise. Very good. Some of our other statins that we have, Lipitor, Crestor. These are all under investigation now, by the way. You're really looking at our anti-hyperlipidemics really needed. You're looking at that now. Whether they are flooding the market with too many of these medications, and are they really effective? So they're doing a longitudinal study, and I think within the next year or two we should have a maybe everything will change again. We'll go back to eating fat. Side effects, as you can see here, one of the important side effects is muscle tenderness. That is an adverse reaction. You do not want to see that. Generally, that is seen with toxicity more than anything else. Or the person has a sensitivity to this medication. So if you're taking this and your muscles hurt, go see your doctor. Peripheral artery disease. We're moving right along. You have any questions? They laugh. No, you're moving too fast. Arterial sclerosis. What is that? Hardening of the arteries, atherosclerosis. Plaque buildup, thank you. Treatment, we have peripheral vasodilators to improve blood flow. You will see, if atherosclerosis or whatever, you will see there'll be other medications to help reduce platelets and all the other stuff that increase blood flow. At the same time, they'll give a dilator to help increase that. The worst I saw was I had a patient who was had severe peripheral artery disease, and the doctor had on his orders, call me if his blood pressure got above 180 over 140. Otherwise, he's okay. What happened to him? He died. Yes, sir.
I had a patient with parameters, he was 200 over 120 yesterday.
And they go, okay. But if you remember, we're talking about peripheral artery disease, we're talking about in the periphery. Okay? Not in the core, but in the periphery. What that causes, if we have any constriction of blood vessels, that helps increase that pressure and everything else within the body and prevents good blood flow. Classifications. You see anything that are familiar? Okay. Because of their vasodilating effect, they are used as peripheral vasodilators as well. We have a hemorrhagic medication called Trentol. What do you think that does? Take a wild guess at it. It tends to destroy components within your blood. You have in your blood too many white blood cells, too many red blood cells, you have too many platelets. This medication destroys those. So now the blood becomes less viscous and flows more easily. Trentol destroys blood things. It makes the blood thinner.
What's the
Literally.
name of the medication?
Pardon?
What's the name of the medication?
Trentol. T-R-N-T-A-L. We have other antihypertensives that we've already seen already. Questions?
You said something about diabetic pressure might increase.